Morning, Mr. Shapiro. Are you ready to go back home? I wanted to take a minute before you leave to talk about the new medication your doctor has prescribed for you. So just to recap, so while you were in the hospital for your broken hip, we discovered that you had atrial fibrillation, or I'm going to refer to it as AFib, which, as you know, is an irregular heart rhythm that can potentially lead to blood clots in the heart. Your doctor wanted to put you on Apixaban, also known as Eliquis, to help prevent a blood clot from forming. So most often, blood clots start in our legs. And Mrs. Shapiro, since you have a broken hip and do not walk that often, this places you at higher risk for developing a deep vein thrombosis, or we call it a DVT, which essentially is a big blood clot in your leg. And being immobile places you at higher risk because your leg muscles aren't moving to circulate the blood in your legs. And a DVT is a big concern because that clot can dislodge from the wall of the vessel, and when it dislodges, it can travel through the bloodstream, and it can get lodged in the lungs, which causes what we call a pulmonary edema, which is a blood clot in the lungs, and that can be life-threatening. It can also travel to the brain and cause a stroke, or ischemic stroke is what we call a blood clot in the brain, and it can even get lodged in your heart, and that can cause heart failure. So for all of those reasons, we want to keep you healthy, and the doctor has prescribed you Apixaban, which is an anticoagulation medication, or a blood thinner, if you will. Apixaban is a direct inhibitor of factor Xa. Okay, so what that means is that there's a process our body goes through when it's trying to make a blood clot. It's a long chain of reactions. So when a blood vessel is damaged, platelets go over to the site of injury, and they form a platelet plug. But it's not sturdy enough to hold it for long. So this needs the clotting factor fibrin to lock it into place and to really sturdy that clot. And in order to activate fibrin, we must go through a clotting cascade. I promise I'll get there. Essentially, factor Xa activates 2A or thrombin, which activates fibrin. And fibrin, remember, was our goal. So again, by taking Apixaban and inhibiting that fibrin, inhibiting factor Xa, which inhibits 2A, which inhibits fibrin, from forming, you are not going to form as many of those clots, which is exactly what we want. I know that was a lot. Do you have any questions? Okay. As we discussed, Apixaban is used to prevent strokes in patients with AFib, just like you, and to prevent postoperative thromboprophylaxis, which means to decrease the risk of throwing a clot, or a DVT. Just decrease the risk of DVTs in post-op patients. So there are some adverse drug reactions I want you to be aware. Bleeding, hematoma, dizziness, rash, GI distress, and peripheral edema. So just keep an eye on those, and let us know if you are experiencing any. I want you to know that there are 2 black box warnings for this drug. So that is a drug that's a warning that every drug, if they have a black box warning, has to be right on the label. It's in relation to the development of spinal hematomas if the patient has an epidural catheter, which you do not, but it's important to mention to your healthcare team if you are ever in a position if you need one. Also, another black box warning for stopping taking this drug abruptly, and that can increase your risk for thrombosis or blood clot. So again, talk with your doctor before stopping this drug. Doctor's gonna be your best friend if you have any questions about this drug. So there are several drug interactions that go along with this medication. Just wanted to double check. Are you taking phenytoin, carbamazine, rifampicin, St. John's wort? No. Okay. Well, consult your doctor before you take any of these because they can decrease the effects of Apixaban. Second list, are you taking amiodarone, erythromycin, ketonazole, HIV meds, diltiazem, verapamil? Do you typically drink grapefruit juice? All right, just so you know, just consult your doctor before you take any meds, because these ones in particular will increase the rate of your increase the effects of your Apixaban. So you're gonna get no clutter, which is not what we want. And just for your record, Apixaban is a CYP3A4 inhibitor, so it interacts with a lot of medications. So this drug in particular can be very hard on the liver. So we will be monitoring your liver function by assessing your AST, ALT, and GGT values when we take a blood test. Now, this drug has an antidote, but if you were to take too much of it, it's called Indexa, and it is very expensive. Just food for thought. I know that was a lot of information, but can you tell me what symptoms to watch out for when you take this medication? Perfect, thank you. So I hope you have a great rest of your day, Mr. Shapiro. Make sure you consult your doctor before you go on any new medications and reach out to us so we can help you if you need. See you soon.